Assalamu alaikum. I am Dr. Umer Salim, consultant pulmonologist. Today we are discussing question number 6 of FCPS Pulmonology paper, April 2015. The question is shown on your screen now. A 37 years of age female, right-handed, presented with complaints of vertigo, left-sided weakness 3 days before admission in the hospital. She felt room spinning associated with nausea and unsteady gait. Dental procedure was performed 9 days back with drainage of periodontal abscess. She had episodes of epistaxis since childhood, long history of anemia, temperature 38 degrees centigrade, dilated blood vessels are visible on gingiva and arm skin. GCS is 12. She is moving all 4 limbs with normal chest examination. Hemoglobin is 10.1, WBC 16.5, CRP 13.2, MRI brain shows right enhancing mass measuring 8 into 9 millimeter in right parietal lobe of brain. CT chest showed an enhancing lobulated mass in the right lower lobe of the lung. A part is what is the diagnosis, B part is how will you confirm the diagnosis. With this scenario, you can think the patient has symptoms starting not from now but from her childhood. There is epistaxis since childhood, so you will not think of anything acute, anything infectious, but you will think of some hereditary disease because the patient has complaints, episodes of epistaxis since childhood, and there is long history of anemia. So our diagnosis with young female with the features of neurological symptoms of vertigo, weakness and room spinning and nausea and unsteady gait. The dental procedure has been performed 9 days back. This is the hint. In this patient, dental procedure is a hint. I will tell you later why. The GCS is 12. MRI brain, yes, MRI brain has a right parietal lobe lesion, and CT chest also shows right lower lobe of lung enhancing lobulated mass. So in this patient we have one diagnosis only, which is hereditary hemorrhagic telangiectasia. Why? Because the patient has long history of anemia, epistaxis since childhood and neurological symptoms and enhancing mass in the chest. So arteriovenous malformations, hereditary hemorrhagic telangiectasia, this is the diagnosis which is causing these symptoms in this patient of neurology and pneumonology. Okay, so this dental procedure has caused the periodontal abscess, which has metastasized towards the brain, and the infection has gone to the brain, causing these neurological symptoms of the brain. So the diagnosis is hereditary hemorrhagic telangiectasia, and the B part is contrast echocardiography, which is bubble echocardiography and pulmonary angiography and 99M technetium scan. I will tell you about the bubble echocardiography. In this bubble echocardiography, which is also called contrast echocardiography, we usually do in the CCU or in the echocardiography unit. We have to give agitated saline. Agitated saline is the saline bottle, which is we will shake the bottle of saline, and it will show micro bubbles which we have to inject in the vein of the patient to see if the bubbles are coming in the right side of the heart within 3 or 5 cycles or later. So I will tell you later that what is the significance of this agitated saline injecting into the vein of the patient to see if this is less than 3.5, less than 3 or 5 cardiac cycles within 3. The bubbles appear in the right heart of the right chamber of the heart within 3 to 5 cardiac cycles, or later, or after 5 cardiac cycles. So this is the diagnosis: hereditary hemorrhagic telangiectasia, and we have to do contrast or bubble echocardiography and pulmonary angiography. I hope you understood the solving pattern of this paper. This is all from me. Thank you so much.
For more solved cases, get this book in nominal price from local medical bookshop or online nationally and internationally from links below.